I'd like to thank everyone, the media persons, our chief guest, our executive director, sir, and the team of administrators from Kauvery, as well as my colleagues of stroke and other doctors. So, I think just make it on. Yeah. So what we call this procedure of thrombectomy, I think a lot of people know, like stroke can be treated within some time when the patient comes in 4.5 hours by injections. So something more new has come in the last 10 years. So if you say stroke is like I just brush upon a little bit. So generally people know there are two types of stroke. One is stroke, which is due to the bleeding in the brain. It's called hemorrhagic stroke. And the second one is due to the block in the stroke or the blood vessel block in the stroke, which is called ischemic stroke. So the main focus is on ischemic stroke because 85% of the stroke is what we see is ischemic stroke. So we are going to talk more about the clots within the brain. And these are the brain blood vessels, if you see, like which comes from the heart. The two major ones, like it's called carotid arteries, and the two back ones, which is called the vertebral arteries. These supply the brain through a complex network by supporting from right to left as well as from left to right. So why do we have to be very fast in stroke treatment? This is something which is very important, and whenever a block happens in the brain, then immediately that cells die. So what is called the core or the red one. Surrounding the core you have a lot of area which is called penumbra, which is a salvageable tissue which can be saved when treated at the right point of time. So if you see in this is what it's very important, like the red is immediately at the time of presentation. If there is a lot of green here which can be saved, so if the patient gets the right treatment, then this green can be saved or the green can become red. So this is the significance of time management to treat stroke. This is one of our patient who came within 2.5 hours of stroke, who underwent a very good treatment through our team, and they became well and good. So this is a different patient who came from a different place, who came after 10 hours of stroke. So what happens is, like you can see, this is the kind of red which has happened to this patient, and this is not treatable in the acute window period. So this is where you have to be very careful about the time, where you have to be very early to detect and treat stroke. So what is this procedure of thrombectomy in stroke? Is like, it's basically a procedure where we go in through the angiographically through the blood vessels of the brain to the point of the clot and then take the clot out. It's like you have a heart block in the infarction, and then people put a stent to restore the blood flow. It's the same kind of a thing in the brain, where you get to the brain blood vessel within 6 hours. It's very much you have a good results with this technique. Whereas nowadays, if you see, there are a lot of advanced imaging techniques which is called perfusion imaging, where you are able to find out where these patients will benefit even up to 16 to 24 hours. So how does this technique, or how does this treatment happen? If you see, it's like basically this treatment happens in the cath lab, and as my colleague told, like it's called something like a neurointerventional cath lab. It's like you puncture the artery in the leg to the groin, you take a lot of tubes all the way to the brain blood vessel, and suppose this is the clot, you try to aspirate the clot through a tube, or you pass a stent and then you retrieve the clot or pull out the clot, or you can use a combine of these techniques, which my colleague will show you some cases as well. So these are the different techniques which we call an aspiration technique, or a stent retrieval technique, or Solyndra technique, where you utilize both these devices to pull out the clot so that you can re-establish the blood flow. So why do we talk more about this technique in stroke treatment? This is a very important slide. If you see, just by injection, like patients who came within the window period of like 4 hours or 6 hours, if you just give injections, 29% of patients, like 30% become well and good, and 20% they have death. Whereas if you see 52% of the patients will become disabled or they will have functional deficits. Whereas when you combine this treatment availability, which all of our hospitals has, like both medical as well as the endovascular treatment of thrombectomy, you are able to give 24% patients more positive outcome, and you are able to reduce the death by 10%, as well as you are able to reduce the disabilities also by 15% in that. So this is where the treatment helps a lot in patients of acute stroke and when they come within the time window. So as everybody says, every minute counts in treatment of stroke, and I hand over the thing to my colleague Dr. K Vijayakarthikeyan. He will update you with some of our patients which we treated by thrombectomy on it. Thank you.